Hospitals are very busy places. One of the biggest challenges that they face is finding somewhere to put all the cars. Many hospitals, like this one behind me, North Manchester General Hospital, are in need of drastic modernisation. These are complex and very important projects. So where do you start? The car park, of course. I'm Dan Whelan, Senior Reporter for Place North West, and I'm here today to speak to Morgan Sindall Construction and the team behind this project to find out why it is much more than just a car park. Michelle, tell us what this project, this car park where we are right now, does for the wider hospital.
Yeah, I think there's three things really for us. Of course, firstly, fundamentally, it provides safe, accessible parking for our staff and patients. Staff and patients will know that they can come in, get their spot and get to work, get to their appointments, taking some of the stress out of their day-to-day use of the hospital. So that's amazing. It's got electric vehicle charging. It's got an amazing cycle up here with showers. So generally, just a much better experience for people coming to the hospital. I think, secondly, what we've achieved in terms of social value with Morgan Sindall, that's really paved the way, I think. So really proud the work that we've done with local people in terms of training and employment opportunities. The knowledge quad that we've had set up over the past year and a half has really provided some great opportunities. So that's really important to us. And then thirdly, of course, in terms of the wider master plan and the new hospital, is a huge step forward in terms of creating the new build site ready for the new North Manchester.
So this project unlocks the wider master plan, doesn't it? It allows you to get on site and get cracking.
Yeah.
Tell us a little bit about what you're trying to achieve with that master plan.
Yeah, absolutely. The master plan was approved in 2021. We've got full consensus of partnership support for that from City Council, from Greater Manchester Mental Health Trust and all our partners across the city. It's really about modern new healthcare facilities for North Manchester. We have a Victorian hospital here which is in desperate need of upgrading.
Okay, so Pete, tell us a little bit about your involvement in this project.
So on this project, High Projects have been project managers under the contract for the delivery of this, but also the kind of key client rep for ongoing engagement with all the stakeholders on site.
Yeah, and I'd imagine there's quite a lot. You've got the contractor, you've got the trust, you guys are involved. Tell us a bit about that collaboration.
Yeah, so we kind of, obviously on a live hospital site, it's quite complex. We've got deliveries coming in, we've got a live construction site, but exactly as you say, it's a hospital site, and that's key. That's the number one priority, to maintain and keep that operational, cause as little disruption as possible.
One of the key considerations now with any project for a contractor is the social value that can be generated through a scheme. Tell us about how that's gone in this particular project.
So with the social value, obviously there's contractual requirements within the social value. So we have a list of requirements for the local spend, engagement with in education, employment, apprentices, etc. What's been really good on this project is it's how it's been prioritised throughout the day-to-day discussion. So every meeting we're talking about the social value, the targets, and where we're up to with the targets. So it just keeps it at the forefront of everyone's mind. It's not something, a tick box, that sometimes you get on these projects.
In terms of the challenges of this kind of project, because this is not just a field where you're building an industrial unit, for example, this is a live hospital environment, lots going on here. How have you found those challenges?
The biggest challenge is obviously working in a live hospital environment, and all of the logistical challenges that brings. These change, if not on a weekly, daily, but sometimes hourly basis, that we've had to adapt and be quite agile, really, when we've been working through it. Some of the demolition that we undertook was quite substantial, quite involved, and in some parts we were working literally metres away from sort of live operating theatres. So that certainly posed a challenge. The other one is in estates of this sort of age, is understanding the infrastructure. Because the buildings that we demolished must be nearly 100 years old, so all the infrastructure that serves it, there's no records. So you were almost reinventing the wheel and really designing on the hoof, really, as our teams demolished it. I'd say they're the biggest challenges that we've posed all the way through it.
In terms of this project, what does it do for the wider hospital? What impact will it have on patients and staff going forward?
I think for anybody that's tried to park at North Manchester, as I did quite regularly, it was a real pain. So the obvious one is we've got a brand spanking new, nearly 1,000 space car park that people can use. which adds to the whole sort of patient's experience really. Because I think, as some people from the trust would tell you, if they didn't mention earlier, it's been a bit trying at times for people to park. So that's the big tick. But also for us, I think we leave a lasting legacy through our sort of whole social value USP that we certainly see as a selling point for us. So we put something back into the local community as well.
And this is, one part of a massive project that's underway here at the hospital. How exciting is it that, to be able to watch that going forward?
Really exciting, and hopefully we've demonstrated what we can do. Hopefully it demonstrates our capability moving forward on the wider master plan here.